My name's Ed Courtney. I'm a consultant general surgeon, but I specialise in treating people with colorectal problems. Most commonly, patients come to see me because they've noticed a change in their bowels. So they either may have become more constipated, or their bowels may become more loose. And another common symptom is they may have noticed some blood. So either they've noticed some blood when they wipe their bottom, or they've noticed some blood in their stools. And obviously they're concerned. So often they'll see their GP, and the GP will refer them to see someone like myself. Most people, we see simple things like hemorrhoids, which are a very common problem, very common cause of rectal bleeding. And so by the vast majority of people we see with rectal bleeding don't have anything serious. They have something like hemorrhoids, or they might have an anal fissure where you have a little tear in the anus. That commonly causes very painful bleeding. So that's another common condition we see and treat. And the other things we tend to see are people may go on to have further investigations. So they may have a colonoscopy. That's where we look round the large bowel with a telescope. And during that we may find polyps. Polyps are very common. Most of them are benign, and polyps, we know if left in the bowel, some of those, not all of them, can turn into bowel cancers. So we're very interested in finding polyps and removing them. Polyps themselves often don't cause symptoms. They can do if they're very large, and certainly if they're lower down they may cause some bleeding. And that's why often when we do an investigation, although we suspect it's not anything serious, we just need to be extra sure and check the bowel to make sure there's nothing like a polyp or very occasionally a cancer causing the problem. A typical patient pathway would be, as I say, a lot of these patients have seen a GP, but we do increasingly see patients who've referred themselves, which is absolutely fine. Patients come along, they'll have a half an hour slot, which is more time than you get normally in the NHS, which is very useful because it allows you to take a very thorough history from a patient, and then we'll go on to do an examination. And obviously we're examining areas that some people might feel a little bit embarrassed by, but this is our day-to-day job. We do this all the time. We always have a chaperone present, which is very important. So we'll examine someone, make an assessment of the problem, and then we'll spend a good 5-10 minutes talking about what I think the likely problem is, whether further test investigations are required, what they are, what's involved with those, and then it'll be a case of arranging those. For me, the patients will come up for a further investigation, which is something like a colonoscopy. It may be a scan, a CT scan or an MRI scan, and then usually once that's been done, the patient will come back for a follow-up appointment. I like everything about the Bath Clinic. I think from the moment you walk in, you're met by very pleasant receptionists. I think it's just a very nice environment to come to and work in. I think that the fact that we get plenty of time here, you get a little bit more time to spend with patients and understand their problems, which is really important when you wanting to win their trust. And I think that everyone that works here is really professional and really dedicated at delivering excellent healthcare. I really enjoy talking to patients. I enjoy winning their trust. I do pelvic floor surgery. Pelvic floor surgery is patients that may have problems, for example, opening their bowels. They may have problems actually with incontinence, and that's a very, very sensitive subject. And I think that some patients may have had these symptoms for years, and I'm always very, very impressed how some patients pluck up the courage to come and talk about these things, because it's not easy for them to do that. And I think that I enjoy winning their confidence and emphasising that they're certainly not alone, that there's lots of people out there suffering with these problems, and that most importantly, I'm sure there's something we can do to help.